Primary care doctors are often the first and sometimes the only healthcare provider a family trusts. They see patients year after year, watching stress turn into physical symptoms, witnessing the cost of silence around mental health, and navigating the delicate line between respecting cultural values and advocating for a patient's well-being. Today, we are speaking with Dr. Usha Singhi, an internal medical physician who trained in India and has practiced in Michigan now for over 30 years, about what she has learned from serving diverse communities when cultural expectations become health risks, and how doctors can help bridge the gap when families don't say what is really wrong. Welcome to Unspoken Minds, a podcast dedicated to breaking the silence around mental health in South Asian communities. I'm Arnav Sagal, founder of Uplifting Minds. In each episode, we bring together doctors, educators, parents, mentors, and students to explore how cultural expectations, stigma, and personal well-being. Through honest conversations, our goal is to create understanding, encourage dialogue, and make mental health support more accessible and culturally informed. Hi, how are you today?
Good. How are you?
Good, thank you. Thank you so much for joining me and taking your time out to talk with me. Would you like to start off by introducing yourself?
So I'm Usha Singhi. I'm an internal medicine physician, practicing for the past 30 years. I did my undergraduate training in India and I finished my residency in Michigan. I have been in practice, as I said, taking care of patients 18 years and over, mostly chronic medical conditions and also mental health diseases such as depression, anxiety, and sometimes substance abuse disorder. I also teach third and fourth year medical students at Wayne State University, American University of Caribbean, and Michigan State. And I also have third year medical residents.
Wow, that's amazing. Thank you for
hmm
everything that you have done to the community. And now you've been practicing internal medicine for over 30 years, and you've been serving patients from many backgrounds in Detroit. And so I want to ask you, how does mental health show up in your exam room, especially when patients aren't coming in specifically for their mental health concerns? Like, how do you see it? When do you see it?
So I'm sure you do understand this, and you have to also reflect that what kind of patients show up in your waiting room depends a lot where your office is. Okay. You said you have been practicing in Detroit. I've been practicing in Southeast Michigan. Uh, the community of Novi and around Novi is vastly different than the community in Detroit. In my office, mental health symptoms are varied. It could be the classic symptoms that we have been taught about of depression, generalized anxiety disorder, substance abuse disorder, uh, or it could be more like somatic symptoms, which could be chronic pain, fatigue, sleep disturbance, appetite disturbance. So, mostly, some people will come in with other symptoms. They will never come and say, "Oh, I think I'm depressed," or "I think I may have a, a disorder which is mental health related. I don't have any other medical issues." They will say, "Well, I have not been able to sleep," or "I don't understand why I'm losing weight," or "I don't understand why I cannot control what I eat," or "I have this chronic pain." And so it can show up in variety of ways. As an internal medicine physician, that's where you're in the best position to try and assess, is there a diagnosis that we can come up with that can explain the symptoms? And then sometimes it is a diagnosis of exclusion. So once you have ruled out other causes of those symptoms, then you can narrow it down and say, yes, these symptoms can be related to a mental health disorder.
That makes sense. And so, I mean, you trained in India and then completed your residency in the US, right?
Mhm.
And so, how did that experience influence the way you understand the pressures that South Asian families face around health and achievement? And of course, you are also a member of the South Asian community. So,
Yeah.
from your experience too.
So I trained in India where I did my medical school, which is a 5.5 year program. I don't know whether you knew that. where you get the degree of MBBS. Uh, Following that, most of us will have to do a residency to get our MD, which could be in internal medicine, which could be in psychiatry, which could be in ophthalmology, which could be in any other branch. I did not do MD in India. I only did MBBS and then came to the US and finished my rest of the training here in the US. So, having said that, when I was training, there was not much focus on mental health. I think because of lack of awareness at that time, 30 years ago, so, but uh, I think South Asian families, we all are high achieving families. I mean, that's what it is. We come from India, but we are typically excelling academically, and then we come here with a vision to excel professionally.
Yeah.
And so we have a lot of that academic pressure. We have a lot of pressure to excel, and we bring that baggage with us, saying that the way for us to prove our worth in the South Asian community here is to excel academically as well as professionally. And we put a lot of pressure because of that.
Do you think that there is a way to kind of balance that academic pressure while still encouraging mental wellness and well-being in your kids?
Well, yes, I think there is. I think we have to teach our kids and our patients to look at things in perspective. We are, things are changing quite rapidly right now. We have to get away from the mindset that a profession that your parents believe is important and which will bring professional success is not necessarily the profession that may be best for your children or your patients. And we have to try to help them understand that, and they, if they do understand that, we have to be supportive of their decision. If a kid walks in and say, I want to be a musician, I think we should be happy. We should tell them, yes, how can we help you achieve what you think will make you a whole person.
Well, so it's nice to hear a different perspective because a lot of people I've talked to in the past have said the opposite. But I'm glad that, I mean, we're seeing progress in this, and I hope to continue seeing that, especially in our generation, right?
Yes.
And now, switching topics a little bit, physical symptoms often tell a story that many patients won't say aloud, that you see in the medical office, right? Especially in communities where admitting that emotional struggle feels like a failure, like we just talked about.
Yeah.
And so, do you think that there's any physical manifestations of maybe stress or anxiety that you see most often in patients in your workplace, especially South Asian patients, particularly young adults, maybe, that families might dismiss as just needing a little bit of rest, or working too hard?
So, yes, I do see a lot of patients with common symptoms of like chronic headaches, or they will come in with chronic pain, or they will come in with symptoms of chronic abdominal issues, like diarrhea or lack of appetite. Uh, and then I see them with sleep. And they do sometimes feel these symptoms are just related to the pressures that they have from studies. Oh, I just have an exam tomorrow. That's probably why I don't feel like eating. Or I just have to get through this application, and that's why I have chronic headaches. But if they become chronic and it's happening month after month, at some point, a physician should have a discussion with their patients after they have ruled out organic things to make sure that they're not dealing with a chronic mental health symptom. And I'm not sure that in my practice, maybe in others, I don't know, that these symptoms are different in South Asian families versus Caucasians versus Black. I think it's the same. They all come with very similar symptoms of chronic illnesses or other chronic issues, and then we need to parse them out and see how much of this is related to underlying mental health issues.
As a primary care doctor, you're
Mm-hmm.
often the bridge between a patient's reality and what their family believes or is willing to believe or willing to accept, right? And so, how do you approach conversations about mental health when family members are present and clearly uncomfortable with the topic, or when they're attributing serious symptoms of a weakness or a lack of discipline?
In my practice, typically, and typically in it could be a South Asian family or Caucasian, as I said, if a parent is with the young adult and they are in the room and they're talking about their symptoms, okay? And if there is a suspicion that we need to have a more honest conversation, I will give the power to the patient. I will ask the patient, do you want your parent to leave the room? Okay. And if my patient says yes, I will politely tell the parent, would you please leave the room because we would like to have a discussion so we can make diagnosis appropriately. And that has worked for me because parents also would like to help their kids,
Yeah.
I think. And once you tell them we are doing that to help your child, we're doing that to make their life better. I think that they typically are agreeable if you explain to them. It may take a couple tries, okay? But that's okay. That's where you bring them in a couple times and you talk to them and you explain to them the statistics and tell them what treatment can do for these patients, how, if the diagnosis is correct, the outlook and life can improve. They then seem to agree.
Exactly. It can be a long process, and
It is a
that's what
long
I've been,
process as a
yeah,
physician, and the patients will come and tell you many times, I don't think that's the case. I think she's just not getting enough sleep. I think she is just tired because she had midterms this week. I think there's something going on in the school that's making her behave like that. And then you have to then explain to them what are the criteria you use, what are the questionnaires you use, with your experience that you have seen patients in the past with similar symptoms, how you have diagnosed mental health disease, and how, in your opinion, it can help. And you have to work with them step by step. This cannot be done in one, two, or three meetings.
and I think that's super important for a lot of people to know. You can't just first off dismiss even
You cannot just,
a
right.
small like thing like you mentioned, like headaches, because you think it's from an exam.
Once they trust you, they will come along with you because they also want help.
Yeah, that's true.
Yeah.
And switching gears a little bit again, in med school, you always learn about how to diagnose and treat,
Mm-hmm.
right? But it doesn't always prepare you for the real life cultural complexities that determine whether a patient can really access that care. And so I've been really wanting to ask this to a provider, but during your medical training in India and in the US, was cultural competency like something that you were taught?
No,
Not at all.
not in my training in India and not in my residency here, because as I said, you have to understand, you're going back 30 years.
Yeah,
Things have changed. And now all that is taught. There is actually a questionnaire that every patient has to fill, which is called social determinants of health. What is your background? Where are you coming from? What is your financial status? What can you afford? What is your barriers to getting care? And now we have to go through that questionnaire at every appointment. So things have come a long way. But when I was in training here or in India, I had no exposure to any mental health. Here, I did do a rotation, and we all have to do a rotation in psychiatry. So I did do that inpatient rotation. And then we were exposed to depression and anxiety and other substance abuse disorders and bipolar and schizophrenia. And so, yes, but not as much as the awareness is there right now.
that's crazy to think about. And you've talked a lot about how times have changed. And so
Yes.
looking back in your 3 decades of
Mm-hmm.
practice,
Mm-hmm.
what do you wish you had known earlier about how to better serve patients um, that you now know?
I think I wish I had more robust training. I wish I was taught the art of conversation with these patients. I wish I was told what leading questions we can ask so that we can make a better diagnosis and identify them early on appropriately without the patient having to bounce from a provider to provider who can then listen to them and say, yep, I think I can help you. Because it's not only the patient's families who do not agree with this, I think there's also certain providers who do not recognize this, and the patients are then sent from provider to provider to figure out what's wrong. So I wish I had been taught how to ask those questions, the art of conversation, and also learning more about their home environment, how to ask questions to a patient about their home environment, what's happening. We never ask that because we are so focused on just trying to figure out what is the next medical thing that's wrong with them, you know? So I wish I had that training. And I think that's happening now.
They're starting to implement that into the training and stuff, which will hopefully allow for better care in the
Yes,
future.
yes,
But for you, experience has taught you stuff that your
yes.
textbooks didn't. And that wisdom is obviously invaluable for the future generations.
Mhm.
And so I want to ask you, what would you tell South Asian parents or just parents from any culture who see their child struggling, but still believe that pushing through and studying harder and toughening up is the right way to go about?
Well, I mean, I have a lot to say about this, okay? Uh, as a provider and as a parent, but I'm going to tell you more like a provider first, okay? I think once as a provider, if you have diagnosed mental health issues, you need to have a conversation with the parent in the room with the permission of the young adult and explain to the parent what that diagnosis means. Explain to the parent how can this be treated, and then tell the parent that the way for them to be there and show up for their young adult is to listen to them without passing any judgment. Just listen to their complaints, listen to your children, listen to them and ask them what is bothering them without just trying to problem solve. Most kids just want to be heard. They know the answers. Okay, everything is available now on online. You can get
Yeah.
the answers. But what they want from their parents is just to be heard. Okay, so ask them what's bothering you. Try to understand the complexities in their life, in school, in their professional environment, in their future. Try to understand what complexities they are navigating. And also, then after you have listened to them, without problem solving, you ask them, is there anything I can do to help? Have the child open up, have the child come up with what kind of help they need. And if the child then sees that, hey, yes, you are vested in my well being, you actually do consider my mental well being more important than my academic and professional well being, then the child will open up and then ask for the help. And at that point, I will recommend for them to see a psychologist. They can do family session, they can do individual sessions, and they can start seeing a psychologist to learn how to do this better.
Do you think like when do you think you people have to like draw the line between just treating it at home and actually reaching out for professional help?
I think right now the line may be drawn a little bit later. I think we need to bring this early on. We
Mm,
really need to bring this early in the process before the child sometimes feels that there's nothing that can be done. They feel hopeless. They feel like there's no solution to this problem. So when they start just beginning to go through some stressful situations, when they start to go through a period where they feel that their parents or even older siblings in the family don't understand them, and they're going through some complex procedures in their school, that's when they should seek help and not wait till it is too late. So even like small things, that's why I think that annual physical is so important. When the physicians can ask them leave, they're only coming for an annual physical. They don't even come for complaints. But you can ask them, well, how do you feel? How's your sleep? Are you having any pain? How's your appetite? And then you can start having this conversation early on. Because I think the earlier you intervene, the better the outcome.
Yeah, definitely. And that's what, like, I guess Uplifting Minds is really trying to push, that early intervention,
Yes,
really trying to encourage families to go and get help before the issue becomes too late and there's not much that you can do, because
yeah,
that's when students start to
yeah.
do stuff like commit suicide.
Yes. As an internal medicine provider, you don't have those tools. You're not a therapist. You're not a social worker. You just need to direct them to the right person so that they have the tools in their pocket to navigate the situations.
And now, before we wrap this up, after all of these years of listening and diagnosing and advocating for your patients, you've witnessed both the cost of silence and the power of having honest conversations.
Mhm.
And so, if there is one thing that you could change about how families approach mental health or physical health, even, what would that be?
For my young adults,
Yeah, particularly young adults.
I think we need to learn to listen to them. That's one thing. I think we should not be quick in jumping to conclusions. We should give them the time and the space and the environment to make their feelings heard, to listen to them, and give them the appropriate means to communicate what they want with us, with their parents, and with the provider. If we can do that, I think it will be so much easier to navigate these challenges.
Yeah, I agree.
Yeah,
It's really important that we start doing that, right?
yeah, yeah, yeah.
Well, I thank you so much for joining me today. I think we had a great conversation, and I hope
Thank
people
you.
at home can learn a lot from our conversation, right?
Thank you. Thank you. Okay.
All right, bye.
Bye.
Thank you for listening to Unspoken Minds. For every physician who has ever tried to heal what culture has taught patients to hide, and for every patient who has carried the weight of unexpressed pain, this conversation honors that struggle. If this episode resonated with you, continue the conversation with your family, your peers, or mentors. Consider following Unspoken Minds for future episodes, and remember, you are not alone, and it is okay to speak what often goes unspoken.